Many of you have been telling me recently that you've been thinking a lot about death and dying. You're asking me, is this normal? And I'm here to tell you it's absolutely normal, because when you're in the middle of a pandemic, you feel a lot closer to death, and we start to realize as humans how vulnerable we really are. With that said, there's actually one nurse specifically who experienced death and dying quite a bit. Her name is Bronnie Ware. She's a palliative care nurse who spent a lot of years helping patients that were near the end of their life. They were very close to death, and she was fortunate enough to have some very meaningful conversations with these folks before they died. In fact, she had so many conversations that she was able to draw some common themes from all the people that she talked to. Whenever she drew those themes, she actually put them in a book. She wrote the book, and the book is called The Top 5 Regrets of the Dying. Now, I'm not going to give you all 5 regrets, but I will give you 3 of them. One of them was, they said that I wish I hadn't worked so much. Another one was, I wish I'd spent more time with friends. And 3 of the 5, that third one was, I wish I'd let myself be happier. If you think about that, really what it's doing, it's bringing us back to how human we really are. And it brings us back to the alignment of what we want to be. In other words, as humans, we really have to do 2 things to feel fulfilled in life. And if we do one without the other, we will not reach that ultimate happiness. It's just a fact of life. In fact, we'll get depressed if we don't have 2 of these things. One is productive purpose. Now, that one's pretty easy, because generally, as you're growing up through school, teachers, counselors, a lot of people, your parents, will help you. They will push you, they'll challenge you to decide what you want to do with your life. And so we find productive purpose in our work oftentimes. But the second one is social purpose. And the second one, social purpose, is not so obvious sometimes, because we're not challenged, we're not pushed to identify social purpose in school. And sometimes even outside of school, we're not. But you see, to really be genuinely happy, to be genuinely fulfilled in life, you have to have both productive purpose and social purpose. And let me prove that you have to by 2 examples. So one is, you'll remember this name, Billy Donovan, Oklahoma City Thunder. He was the coach at the University of Florida, and after bringing home the 2nd national championship, he was depressed. He says that he had just lost his why. He had forgotten what this was all for. Tom Brady, after winning his 3rd Super Bowl, he asked the question, is this what it's all about? And what he was identifying was that he did not feel fulfilled by having rings and trophies. But instead, he pointed out that if that's what you focus on, if you focus on winning the trophies and the rings, that you will lose the most valuable thing that you've earned in life. And that's the relationships that come from achieving something bigger than yourself. The relationships that come from working as a team, working together, whether it's in relationships or friendships, but working towards a common goal that you would not otherwise be able to achieve on your own. That is what builds the most valuable relationships. So when you consider what your social purpose is going to be, in other words, where you're at with your relationships and what impact you want to leave, I'll ask you this question. When you interact with people day in and day out, whether it's your patients, whether it's your clients, your customers, or people you run into at the grocery store, maybe it's a complete stranger, what is your purpose? What is it that you want to achieve in that interaction? If that person was the last one you interacted with and they ended up at your funeral, and let's say you ended up dying tomorrow, what would you want them to say? How would you want to be described? How do you want to be remembered? Because whenever we think about pandemics and viruses that don't have cures yet, and the severity of infection, and we think about death not only of ourselves, but even family members and people that are important to us, people that we have relationships with. And we have to ask ourselves, if they died tomorrow, would I have regrets? If I died tomorrow, would I have regrets? Because you don't want to leave the world with regrets. And so how can you identify what regrets you would have? By thinking about it and then taking action to change it. And you can do that today. So I challenge you, perhaps you already have that productive purpose. And maybe you work in healthcare and you've got your productive purpose identified, and you work hard day in and day out to save lives and save others. But what's your social purpose? What is that impact that you want to leave with every interaction? Because when you identify that, it will change your behavior. It won't matter if you're having a good day or a bad day. You will treat people the same because you have a purpose. You want to leave a certain impact. You want for people to think of you a certain way whenever you're dead and gone and you have people speaking at your eulogy. And so I challenge you to think about that. During times when we are thinking more about death and dying, think about what regrets you would have and develop an action plan to change that today. Think about your social purpose. Have you identified it? And if you haven't, what do you want that social purpose to be? What do you want your relationships to look like?